The robotic surgery. So, what is robotic surgery? It is a procedure that uses a robotic surgical system to perform operations on its patient. It is somehow an advancement form of minimally invasive surgery that uses a computer-controlled robot to do what humans can and what they can do but better. The Da Vinci system is the most used robotic system over the world. Now, how does it work? This procedure could be done while a specialized surgeon is sitting at a special console with hand and foot controls that allow them to remotely and precisely control surgical instruments attached to robotic arms. There is a camera attached to the robotic arms which allows the surgeon to see a magnified three-dimensional view of the patient's surgical site in their viewing screen. Adjustments can also be made to change the scale of the robot's movement. For example, a 3 to 1 scale would mean that the tip of the robot's arm will move 1 inch for every 3 inches the surgeon's hand moves. However, it doesn't mean that during this kind of procedure there isn't a complete surgical team present inside the operating room. The patient is still surrounded by a team of healthcare workers to verify the correct placement and function of the surgical instruments.
What is the science behind this technology? It is the Da Vinci surgical system. It consists of ergonomically designed surgeon console, a patient cart with 4 interactive robotic arms, and a high-performance vision system and patented under-risk instruments, which makes it more advantageous than the traditional techniques. Because the Da Vinci procedures are performed for a wide range of conditions in specialties including cardiac, urologic, gynecologic, pediatric, and general surgery with less risk of infection, less pain and blood loss, and smaller scars. In addition, the Da Vinci system is remarkable improvement over conventional laparoscopy because surgeons can now operate while standing and use handheld long-shafted instruments.
How was the science harnessed into technology, and what are the problems needed to be overcome for your technology to happen, and how were they overcome? The engineering of robotic surgery provides precision, accuracy, and stability in the procedures. Yet, these robots are still dependent on the controls of the surgeons and does not have the artificial intelligence to perform surgical procedures independently. The first generation robotic surgery, Puma 200, Scara robot, and the Robodoc, and the Acrobot required human surgical review at the end of every step of robotic surgery, and robots could not perform multiple sequential tasks on human subjects unsupervised. There has been a safety doubt on the robots on damaging the tissue and affecting the overall life of the patient. Another problem is questioning the need of such technology since robots do not have the clinical eye and decision making of the physicians in performing therapeutic and or surgical interventions. Moreover, there is also a need of dexterity and flexibility on operating tissue that shall not be limited only to organs which the technology provides. To develop such technology, huge amounts of money is needed not only for funding for the research but as well as building the machine itself. In this contemporary world, everything is fast-paced, and what engineers and physicians develop is continuously innovating. The physicians require extensive training to perform surgeries with these robots, or these robots be coded with machine learning for the continuous improvement of healthcare.
Who benefits and who suffers from this technology? According to UC Health, the one who benefits from this is mainly the patient. It shortens the hospital stay, help reduce pain and discomfort, promotes faster recovery time, allowing them to return to their normal activities. Since it causes smaller incisions, it helps in reducing the risk of infection and minimal scarring and reduced blood loss and transfusion. Another beneficent are the surgeons, because as stated in Ariana Health, it allows the surgery to be done with precision. This technology also enables the surgeons to thoroughly examine the area that is being operated. This gives a clearer view to the surgeons, which is highly beneficial for them to precisely conduct the operation because some things are not clear with the naked eyes. What are the social and financial costs? Robotic surgery has an impact in the society, especially in the medical field. These help in minimizing mistake in surgical operations, which benefits both the healthcare team and the patient undergoing procedure. Robotic surgery generally costs as much as $1,200 to $2,000. A single robot costs about $2 million. The system has an annual service contract requiring between $100,000 to $170,000. These rates justify the higher price of robotic surgery compared to laparoscopy surgery or open surgery. 500,000 pesos in estimate for undergoing robotic surgery in the Philippines, according to TechPinas 2015.
So, proceeding to what are the risks of this technology. As to how any other procedure, This technology holds a couple of risks or complications that may occur. Robotic-assisted surgery shares the same risk of open and laparoscopic surgery, including the potential for infection, bleeding, and the cardiopulmonary risks of anesthesia. On top of that, there are additional risks that are unique to the robotic system. Not only is there potential for human error in operating the robotic technology, but an added risk of mechanical failure is also introduced, such as malfunctions in the system and the robot itself, which can cause burns and damages to nerves. Complications occur based on your condition and the type of surgery you undergo. These include bleeding or the need for transfusion, risk of infections, temporary nerve or intra-abdominal organ injuries, breathing problems, stroke, heart attack, blood clots in the legs, or reactions to medications. So how probable and how severe are they? The Da Vinci surgical system's great visibility and the high-performance surgical instruments considerably lower the risk of common surgical complications. The only risk that is specific to robotic surgery is the robotic system malfunction or fail. Although mechanical failure and malfunction are very rare and happen in less than 1% of the cases, these can potentially happen. What has been or can be done to minimize them? Robotic surgery is intertwined with a lot of risks. Preventive measures and solutions are necessary in lowering these risks. The following measures are appropriate to assure that required safety. Developing a dedicated robot system for medical applications such as surgery or interventional procedures that adapt industrial robots. Reducing the speed of robotic movements and use redundant sensors in order to improve safety. Always ensure the sterilization and infection control in the operating room and interventional suite. Systematically analyze the safety of a robotic system to determine whether they would compromise the required safety in the operating theater. Proper credentials and trainings of surgeons performing RAS, more detailed guidelines and rules to follow in the system. Appropriate risk disclosure to patients for awareness of the system and the possible risks of it. As mentioned, robotic surgery is generally safe and with low overall complication rates, but still it holds a lot of risks, which is why preventive measures and appropriate knowledge and skills are necessary, especially of the surgeon in charge.
Now, do these costs change over time? As our technology advances, it brings the world a considerable diversity. We all know that there are surgeries in which we should observe the dexterity of movement. Medical robotics being used for about 30 years, this robotic surgery, or most commonly known as the revolutionary by the surgeons, brought us the advantage most especially for the minimally invasive surgery. These advancements continued through time. Now we have the capsule robots, the microbots that cause changes over time in the field of allied health organizations. Changes in efficacy, time, convenience, and of course, the amount to be paid for the procedure. Now, do some develop more quickly or slowly than the others? How? The development progresses differently in every nation or state as privileges also varies, mentioning that these advances require a large amount of money. There are some that develop quickly and there are others that is being left behind. This is due to the economic status of the nation as well as the manpower. We all know that for a development to occur, this requires more than intelligence and dedication. This needs funding and workforce.
Might there be risk to not using this technology? Being said that robotic surgery allows doctors to perform many types of complex procedures with more precision, flexibility, and control than is possible with new techniques. It's usually associated with minimally invasive surgery or procedures performed through tiny incision and in certain traditional open surgery procedures. And if it is not used, I think there will be risks such as death and malpractice, since technology helps to have greater visualization, enhanced dexterity, greater precision in infrequent surgeries. And how do they compare to the risk using this technology? It's indistinguishable as the risk remains the same either way, since there is not only the risk of human error when operating the robotic system, but also the potential for mechanical failure. Any surgical treatment carries risks, using either traditional or robotic surgery, or even the simplest procedure that can result in unexpected consequences such as bleeding or infection. That's why a surgeon always compares carefully the possible risks versus the potential benefits of surgical treatment that will be used.
It is said that many surgeons use the robotic platform for the reason that it has more technological advances, including high-definition 3D optics, wristed instruments, camera stability, and improved ergonomics. While robotic surgery continues on its path in medicine, it remains controversial due to its cost-effectiveness and its long-term impact on clinical and oncological outcomes. According to Dr. Stephen Wexner of Cleveland Clinic, Florida, he doesn't believe that robotic colorectal surgery confers any any advantage to his patients. He mentioned that whenever he has a case of rectal cancer, he performs laparoscopy using 3 to 4 ports. To do the same thing robotically, this would need a minimum of 5 ports. Laparoscopic is also much more cost-effective and much quicker compared to the robotic procedure. It is significantly more expensive. He cited that Dr. Michael Stamos published data that robotic rectal cancer surgery was $25,000 per case more expensive than laparoscopy. The question here is, why do surgeons perform robotic procedures? Their first reason is that with the advancement of technology, they feel that if they do not use and offer robotic surgery, they will lose patients and the credibility of the institution. Second, some surgeons are not yet mastered in performing laparoscopic pelvic procedures, and they use the robotic one as a means of transitioning from the open to the minimally invasive approach. It was suggested that if robotic surgery wants to be widely adopted by everyone, the procedure must have at least equal outcomes at reduced operative and hospitalization cost, or even the same cost but better outcomes in terms of recurrence and complications. Nevertheless, there is no such a big difference between the two procedures in outcomes. It is just the cost and operative time that will be consumed.